symptoms of vertigo be confused with the symptoms of other diseases or conditions?
Absolutely. So there is no fixed picture. And vertigo itself is just a symptom. Dizziness is just a symptom. We really need to understand that these are not diseases, disorders. Vertigo is not a disease. It is just what the patient is complaining of. They might feel that, oh, bending down and I feel that I may have a fall. So all of these things we have to, of course, take a detailed history in what they are feeling. What are their associated problems? Is there any problem in hearing? Is there any unsteadiness on walking? Do they have any other disorders like maybe hypertension or heart disease or maybe diabetes? And also, what are the medicines they are on? So, by taking a complete holistic overview followed by tests. So with the test, we're actually able to measure each part of the balance control, the visual system, we call it the oculomotor system, and all the connections to the brain. And then we're able to identify, okay, in this patient, this is the cause of their problem.
If I have vertigo and I need to seek help from you, what might be the steps we take, like how it will look like? Maybe you can walk us through the
whole process. Absolutely. So what typically happens is that, so suppose a person comes to me, we take a detailed history, as I just said. It takes about 20 minutes or so for understanding what problems the patient is having. And then we refer the patient for testing. The testing involves different kinds of equipment. We start with the things like we call it the video nystagmography or the video oculography, in which cameras are used, and all the tests are totally non-invasive. So in different ways, we are evaluating how the patient is able to perform those activities and compare it with the normal versus what they are having. According to that, we are able to decide where the problem lies. So once all the tests are done, all reports are then analyzed by I as a neurootologist and neurologists. And then we then decide this is the problem which the patient is having. We call it the clinical interpretation, and then follow it up with the treatment planning. Some patients will require medication. So patients like vestibular migraine, in which the migraine is affecting the balance control. Patients who have in the acute vertigo, that means they come in with severe vertigo, which could be due to a condition like Meniere's disease, in which the inner ear pressure is increased. Then we work with dietary modifications, we work with treatment, things like that. Some patients may have a problem in which the balance nerve is not working to the optimum. In those patients, we work with vestibular rehabilitation. So the patient is then referred to our physiotherapist. If the patient cannot come to the clinic, even remotely, we are treating patients all over the world, giving them the required vestibular rehabilitation with online sessions, maybe 2 times in a week, and exercises which we provide through the app on a longer basis. We also always take a feedback as a follow-up, maybe different conditions, maybe after 4 to 6 weeks. How are you doing? And then decide the next steps. So that's how we work.
If a person is doing PT remotely, how are they corrected and prevented from falling? Does insurance, Medicare cover evaluation and therapy?
At present, we are not in the US. We have applied for FDA, and once, I mean, we are in the process of getting that. But until then, I don't think insurance or Medicare covers anything. If you were to come to any of our clinics anywhere else, I'm not sure how it would work. But the physiotherapy, so I cannot give you a cure on the first day. It is a process. We have to work with the stability techniques, working on the balance control. And with that, over time, we can improve the steadiness and the balance activities. And the physiotherapist, of course, tells you what to be careful of, what they are allowed to do, and what are encouraged. We are always encouraging activity.
I think, for US, there will be different insurance provider. So I think what we normally do, I think that is something that all of our participants can look at who would like to, access this solution, to look at your provider and the components, because as Dr. Anita mentioned, there are a lot of components to the solution. Okay, so you have to see, it could be physiotherapy, it could be various other aspects of it, right? So you need to see what is covered within your insurance provider and then proceed, because it's not going to be the same even across all the people in the US, depending on what category of insurance and so on. So I think all of us do that for our own, therapy, right? So I would say that one needs to really look at your respective insurance policies and coverage, and some of it will definitely be covered. There's no question. But what exactly, what not, that those details are always the fine print that insurance providers they tell you to look at. So that's what I would say.
So one is, if somebody needs the prescription, do you provide the guidelines so they can talk to maybe their primary care or something who can help them into that? That will be one. And maybe will you be able to highlight more on nutrition and lifestyle? What can people do to make any small changes in their diet or lifestyle, which might be helpful for this problem?
So, absolutely. So, basically, we have to again work very individualized according to the patient's problem. Person who's 25 years and has a vestibular migraine, that means we have to work with lifestyle modifications working towards the migraine problem. That means eating on time, not skipping meals, sleeping on time. So, and in some patients, reducing screen time, working with your caffeine intake in that situation. So these kind of things, we provide all those lifestyle modification tips. We often need to work with counselors as well, because of this hypersensitivity of the system. We have to calm down the brain, control negative thoughts, and help the patient be more confident to be able to basically work and how to get out of their problems. Now, if I talk about suppose a patient, maybe a 65-year-old patient who is unsteady and imbalanced, for them, again, we will give them some tips of things like, you could say, grab bars and other things of how to get out of bed and all that. But the more important part would be the physiotherapy part, because we have to finally strengthen the areas where we are seeing the weak points, and gradually over time be able to make them more mobile, increase their the field of their movements, their angles, their speeds, working on all of that to give them more stability. So it will be variable with the cause of the problem.
How to contact to get medical advice, especially for patient in India. No insurance, to get an idea how expensive to get evaluation and treatment.
Right. So we have clinics all over India, and we can help you in getting an evaluation done and then the treatment. So I would say it's not really very expensive. Everything, if I put it in rupees, it's less than 10,000 rupees for an evaluation. Testing takes about 2 hours. Totally non-invasive. Everyone can get it. And from there, we work on the treatment planning. So it's you need the answer. The most important thing is you need an answer of what is happening, and then is actually how the treatment will start.
Are there any specific risk factors that make some individual more susceptible to experiencing vertigo?
Yes, absolutely. So you often wonder that why a 40-year-old is more stable while an 80-year-old is at more risk of fall. That is not because that situation, that slippery bathroom has not changed. It's the same for both people. But the difference is that the reflexes and the cognitive control of the person who is maybe less active, less mobile, and less mentally agile as well is not able to control the body in those same situations. So we need to work on not just improving the physical health, the physical ability, we also need to work on the cognitive problems, because that is how the processing is happening. All the central processing and the control is through the brain. So always in patients over a certain age, when we see in our test, we also are able to pick up some cognitive problems as well. And then we work with them on trying to improve those, trying to work on, they often become passive. That means, no, if they watch TV or they listen to music or read the paper, it's all passive things, nothing coming from their side. So we need to promote active mental tasks. It can be right from a Sudoku to playing cards to talking to people to reading the paper and writing what have they understood, anything. But it has to be some sort of mental activation which really helps these people.
Will you highlight a little bit about the medical management, like maybe what kind of medicines are normally prescribed and the duration?
Absolutely. So I would like to then talk about different medical conditions which can cause these problems, and then we decide according to that what medication is required. So if a patient has something like acute vertigo, patient comes with an acute episode, is having nausea and vomiting and spinning, everything, we have to decrease those symptoms. So drugs like meclizine, like prochlorperazine, things like that. We give medicines only for a short while to reduce those symptoms, usually not give it more than a day or two, or as an SOS, that means as required. If they have an acute episode, they can take a tablet. But in general, we discourage the use of these drugs, which are called vestibular suppressants. They sort of bring down the symptoms. They're very good in the acute phase when you have an emergency, when you have an patient is not able to get up. But it should never be prolonged for more than 3 days, because that slows down the brain, slows down the whole recovery of the body. Now, if a patient has, suppose, what we call a vestibular neuritis. Vestibular neuritis or acute vestibular syndrome is an infection of the balance nerve where the patient suddenly, like just like that, suddenly starts feeling dizzy, vomiting. For these patients, often we need to put them on a high dose steroids for a short while and then quickly follow with vestibular rehab. It's just like a paralysis of the balance nerve. So first we are trying to reduce the inflammation or whatever cause was to reduce the function, and then try to activate it with the exercises. And these patients usually recover very well. Patients who have slowing down of the system actually require very little medication. We have to activate, as I've been talking to you about, in different ways with the vestibular rehab, and that by and large is their treatment. We often have patients with different medical issues along with their dizziness. Now, how do we work with them? We always need to make sure that is there any drug which could be increasing their imbalance. So some patients are on drugs like sedatives or multiple sedatives, or on antidepressants or anti-anxiety or sleeping pills. As you age, it is important to be able to have a rational prescription. That means, although different diseases need to be controlled, whether the hypertension, whether the diabetes, whether the cholesterol, all of those things need to be controlled. Are they on a diuretic? Is it an optimum dose? If a patient has maybe a seizure disorder or epilepsy, is it interfering with the use of some other drug, we are looking at those prescriptions, because polypharmacy can also sometimes cause dizziness if it is not in a correct dosage. So all those things need to be checked out.
Doctor, we have another question. How can people overcome fear of falling and relearn to walk on uneven surfaces after suffering falls?
Right, absolutely. A very good thing. So I think that question is very, very relevant, because a patient who has had a fall is now very, very fearful. When you get out of bed, a person who has this problem, I would advise that one, get out of bed slowly. So first you're going to sit, and then maybe after 20 seconds, then you can stand up. And then again, be careful as you take your first step, then you should be fine. The problem is that the fear that, okay, if you are aware of it, the thing becomes less, and just look around, where are you? But remember, we're looking at all of your inputs. So the eyes, the balance nerves, and your legs and muscles. So remember to work on all of these. That means if it is dark, be extra careful. Turn on the lights. If you have to go to the bathroom at night, you must have a night light. The surfaces also, walking on a firm surface will make you feel more stable. Working on maybe the grass or the steps. If you are using the steps, always hold the railing and use it just to provide that extra stability, because unsteady surfaces, grass, or you can have thick carpets and all of that, which do not provide enough sensation to your feet, can also cause a problem with the balance.
One thing, it's like there are certain medications seem to interfere or cause this symptom, when you look at any label for prescriptions.
Absolutely.
So what are the common medicines one should watch for?
Absolutely. I think half the medicines in the world have dizziness as their side effect. So, but in the correct dose, for the correct indication, mostly you should not have a problem. But when you combine these drugs, and that is where things can happen. So of course, US I'm not talking about, but often in India, what we see is you go to the orthopedic person, they have their prescription. You go to your cardiologist, you get another prescription. You go to your endocrine and another prescription. Or it goes on and on. So, and people often follow all these prescriptions. They're not talking to each other. And then that is where we often see drug interactions. Some drugs, that means like a patient with diabetes cannot be given certain drugs. A patient with glaucoma cannot be given certain drugs. So those kind of things, in our clinical decision support system, we have the mechanisms to minimize those, you can say those the side effects or the drug interaction negative effects which the patients may have, and also be able to control those problems. We can call it the complications of medication, right? So we do need to look at it. So you will need a physician to see all of the medicines which are being taken by the person to ensure that this is the optimum requirement.
Okay. Doctor, are there any home remedies that can alleviate vertigo symptoms?
I think the first thing, simple thing, what you can do is slow down your movement. When you are having an acute spell, sit down, keep your eyes open, and just look at one point. What I often tell my patients, just look straight ahead or at any one point in the room. And then you'll see, especially if it is a vestibular problem, a problem related to the inner ear, the symptoms often will reduce, right? That is like a temporary reduction in the symptoms. And if it is related to the brain, you'll see that it will not reduce, right? So be aware of this. If you are having problems like slurring of speech, blurring of vision, some slowing down of any part of the body, severe headaches, please do take this as an emergency. Any loss of consciousness, it is an emergency. It needs to be handled by a physician, or you need to go to the ER. But some things, if you think that it gets reduced when you do that, it's probably more commonly related to the balance nerve. And that can be then evaluated and understood how to treat it. But I cannot give you some one exercise treats all, one medicine treats all. No, it doesn't work that way, because it is a very, very diverse field, many causes. It is multifactorial.
Are there any preventive steps you can recommend for anyone to?
Preventive, be active, be happy, be social. I think that is the trick. I think keep yourself. Age is not a disease. Aging, what people say, okay, because of age I have this problem. I'm sorry, I do not take that, because I do not agree that age has anything to be a part of it. It's basically, how do you take care of your body? How are you using your mind? And how happy are you? So my father-in-law is 83. He is still working in the Supreme Court. He is walking. He is more active probably than I am. So I think he is an idol for me. And age is just a number. It is not a limitation at all.
Alcohol or the smoking or the tobacco use, how it connects to this?
So alcohol sort of slows down brain activity, right? Social alcohol is not a problem, but when it becomes over a certain limit, it basically, of course, affecting your liver, but for me, more importantly, affecting the brain, right? It slows down the mental processing, your reflexes. And so in moderation, everything is fine, but it does slow it down. And when you talk about smoking, it affects more the nerves. And especially if there is diabetes or hypertension associated, we are very careful, because we call it neuropathies, right? So hypertensive neuropathies, diabetic neuropathies, it affects the eyes, retinopathy. If your vision starts getting clouded, of course, the inputs to your brain get affected, things like that. So all of these do have an impact on the overall health.
What are the most effective diagnostic tests for determining the underlying cause of vertigo?
Right. So for this, we have various tests. So we start with a video oculography, which are infrared cameras to record the eye movements and perform various, we call them oculomotor and vestibular tests. Other tests which we do are things like posturography, to be able to measure and understand the postural control of the person. We have tests like subjective visual vertical. So the inner ear has two functions. One is angular acceleration, if I turn my head, and how is the control. And the second is linear acceleration, forward, backward, up, down, side to side, which is also perceived by the inner ear. And that is controlled by an area called the otolith. So for evaluation of the otolith system, we use a test called the subjective visual vertical. We do tests like the video head impulse test, dynamic visual acuity, and things like that. For younger children, we have rotary chairs in which we rotate the patients and then measure the vestibular activity.
Can it be hereditary? Like suppose someone is having vertigo and like her sister is also having vertigo. So it is going on. So can it be possible like it has a hereditary connect?
Absolutely. So there are certain disorders which run in families as well. or just like the simple vestibular migraine. There are often many migraine patients within a family, right? So, but again, evaluating, and each patient will have to be seen in their own individual way to see how the system is getting affected. Some Meniere's disease patients can be in this family. Multiple sclerosis is another condition which can be, we have been able to pick up multiple sclerosis patients which were not even picked up by the neurologist, because our test pick the nerve activity up very, very early. So all of these things do help. You were asking me about maybe the take home message. So I would say awareness. Understand what is going on. You do not have to live with this problem. This is not part of aging. If we can identify whatever issues you are having, find out what is the cause and help you. There is no reason at all why we cannot help. So I, as Ritu had just said, chronic vertigo. So people often tend to neglect it, or even though they have been to people, have been to doctors, it has not been adequately managed. So trying to understand with specialized equipment that what actually is going on will be the first step to getting better. So do be aware that there are solutions, there are ways to get better. You do not have to live with the problem.